This video is about OET listening part A. Let me guess this. Part A starts playing and 20 seconds in, you're already behind. The patient is still talking, but your brain is still stuck on blank number 1. Sound familiar, right? You don't need better ears. You need better real-time decision making. So in this video, we are going beyond basic tips. We are rewiring how you think during consultation because you already know how to listen. Now it's time to listen like a clinician under test pressure. Let's make you unstoppable in part A. OET Part A is not just a listening test, it's a thinking test under pressure. You don't just hear, you need to identify, prioritize, and record in real time. Yes? So here's the shift. Most candidates transcribe, high scores triage. That's right, like a nurse triaging patients. You must decide, is this word vital? Is this information relevant to a blank? Do I jot it down immediately or hold for confirmation? You're not writing everything, you're capturing what serves your diagnosis, or in this case, your marks. Just like you don't document every patient word in real life, in Part A, you only document what's medically and contextually relevant to the prompts. Got it? Okay, I'm just going to introduce a three-level listening formula. Okay, it's a unique framework to train your brain for part A. Please grab a notepad and make a list of all these things so that it would be really helpful when you're applying these strategies, techniques in your exam. Okay, so the first level is data recognition. Your ear captures the data, right? A number, a symptom, a drug. Example, I have had this cough for about 3 weeks. So immediately your brain should think about the duration and symptom. And level two is context matching. Your brain checks. You have to think it in such a way whether this fit a blank I previewed. If the prompt was like duration of cough, so this is your target, right? So you need to look immediately or you have to catch the options which are relevant to the duration of the cough. And level three is response action. You don't write 3 weeks ago or started 3 weeks ago. You write exactly what's needed. Just write 3 weeks. So, why this works means it cuts the clutter, it prevents overthinking, and builds confidence in output. Here is an example. So, instead of an audio, I'm just going to talk, listen carefully, and then start to find out the answers for these 12 questions. Okay? So it's a consultation, chronic shoulder pain. It's a physiotherapy referral. So Dr. McKenna is asking, good morning, Mr. Bellamy. I see here you have been experiencing shoulder pain. Can you walk me through what's been going on? Sure, doctor. It started around early June, so just over 3 months ago. At first, I assumed it was just from poor posture or maybe sleeping funny, but it hasn't gone away. Is it constant or does it come and go? It's more intermittent. Some days it's barely noticeable, but when I'm working at my desk for long hours, it gets pretty sharp, especially when I raise my right arm, reach behind me. Okay, and is it affecting your work? Yes, actually, I work in IT, mostly remote, and I'm often on the computer for 8 to 10 hours a day. I have had to adjust my workstation a bit, but it only helps marginally. Any prior injury or trauma to the shoulder area? Not that I recall. I used to play recreational hockey in high school, but nothing recent. Have you taken anything for the pain? Just over the counter ibuprofen. It eases the discomfort a bit, but I try not to take it daily, maybe twice a week. And do you have any other medical condition we should be aware of? I have mild hypertension. I take amlodipine 5 mg daily. That's about it. All right. Given the ongoing nature, of the pain and the impact on your daily function, I think it's best to refer you to a physiotherapist. They can assess for things like rotator cuff involvement or impingement. Sounds good. Would I need imaging before that? Not necessarily. We'll start with the conservative management. If there is no improvement after 6 weeks of targeted physio, I can request an MRI. Meanwhile, I would suggest continuing with ibuprofen as needed, applying ice after long computer sessions, and avoiding overhead lifting. Understood. Thanks, doctor. Now, you listened to this conversation, right? Here are the questions, okay? And I hope you all come up with the answers for this one. So, first one is onset of symptoms. Second is initial cause suspected by patient, pain pattern. The third one, aggravating activity, arm movement that worsens pain, occupation, average daily screen time, over the counter medication used, medication frequency, existing medical condition, current prescription drug, and advise continue medications, apply dash, and avoid overhead lifting. Alrighty, we'll just check with the answers now. So, for the first one, the answer is onset of symptoms early June. He said like it started around early June. Did you remember? And for the second one, initial cause suspected by the patient. Yes, he mentioned that. He guessed at first, he assumed it was just from poor posture. So poor posture is the correct answer. And for the third one, pain pattern, intermittent, direct word from the patient. We got it. It's more intermittent, he told. And aggravating activity, yes, he mentioned about when he was working at his desk for long hours. So desk work, and then arm movement that worsens pain. So whenever he raised his right arm or reach behind, then he was getting the pain, right? So raising right arm. And the occupation, yes, he said he's an IT professional. And average daily screen time, he mentioned that too, 8 to 10 hours a day. So 8 to 10 hours. Over the counter medication used, ibuprofen. And medication frequency, he used to take twice a week. Existing medical condition, yes, he told he had mild hypertension. And current prescription drug is amlodipine, 5 mg daily. So current prescription drug is amlodipine. And advise continue medications, apply eyes. Okay, fine. Now, I have a plan for you. Okay, it's a 4-day advanced training cycle, which you can work it out to check your results. So, day one, what you have to do is do one consultation, write full notes, and compare with the answer key. You need to highlight what you missed versus what you understood. It's a kind of a self reflection. And in day two, play the same audio, and here you have to stop after every 30 seconds and then try to predict what will be said next. This means like you are building your prediction muscle, okay? And day 3, you can watch any two random real clinical videos on YouTube, and you have to write note style summaries in 5 minutes max. Got it? On day 4, now, this is the time where you have to practice one full test under exam timing. So, you have to focus only on flow and real time response, not perfection. Got it? So, here are my final rapid fire tips. Don't chase for perfection, chase comprehension. And try to use medical context to predict answers like symptoms, diagnosis, treatment. So you need to be aware of the medical context, and don't stare at gaps. You have to focus on flow. The OET is not trying to trick you, it's trying to test your professional recall ability. Keep that in mind. So that's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye bye.